And today we are over 9 months into COVID-19 and the pandemic that has inflicted unthinkable losses on our country. Over 280,000 Americans have died from the virus, and countless are indeed suffering. Scores are sick and or those who have lost loved ones. Our frontline healthcare workers are overwhelmed and overworked as they continue to risk their health and that of their loved ones to care for those who are sick. Millions of Americans are unable to work. Families are struggling to put food on the table, and many are behind on rent payments. Our people desperately need solutions. Ways and Means Democrats have convened this listening session because we know these challenges aren't new, but it's more important than ever that we take action. The COVID-19 pandemic has worsened the hardships faced by workers every day. We've all heard from constituents who are enduring nightmare aftermaths from those who have suffered through this virus. Whether it be that of those who have been denied unemployment insurance or those who are risking their own health to continue showing up for a job with inadequate personal protective equipment, they are being pushed to the limits. Lisa is a constituent of mine who lives in Springfield, Massachusetts, and she has shared her story with my office. She was a United States Postal Service employee until this past May when she left her job to help her daughter, who was struggling with online learning at home. After taxes, her weekly unemployment benefit is a mere $80. So she picked up part-time work at Dunkin' Donuts to try to find out if she could make ends meet as the crisis continues. Joining us today for this session is also another constituent of mine, James, who was a teacher in Springfield and will be sharing his experience grappling with the pandemic. I want to thank James as well for the time that he will offer to us today for advice. An economic recovery would provide some relief to people like Lisa and James. We can prevent a complete economic crash by providing unemployment benefits, stimulus checks, and other temporary measures that prop up our economy, and indeed in the CARES Act worked. But a real recovery won't happen until we have eliminated and defeated the virus. And last month's job report indicated the state of the economy is linked to the severity of the pandemic. This listening session, it follows another one the committee Democrats hosted this summer ahead of the cutoff of the $600 per week emergency unemployment insurance supplement, which allowed many workers to keep their heads above water, and indeed, let me proclaim, it worked. Senate Republicans allowed this vital benefit to end, even as House Democrats passed an extension of the assistance and pleaded with our counterparts to join us at the table. It seems now that we are finally close to congressional agreement on another round of COVID-19 relief. This package, we know, won't solve all the longstanding challenges that America faces on behalf of its workers, but we expect and anticipate it'll be another good investment. Today, we will hear about the unique and pervasive ways that this pandemic has affected all types of workers. I am extremely grateful to the 10 individuals from across the country who have joined us to tell their stories and to share how the COVID-19 crisis has affected their lives. My colleagues and I appreciate their courage and candor during these frightening times, and we hope our colleagues who have stood in the way of both short-term relief and long-term solutions like universal paid leave, child care access, adequate pay, and fair treatment of workers, we hope they're all listening too. So first, let me introduce Alicia Cleveland. She lives in Georgia, and I'd like to ask Alicia to tell us about her story.
Good afternoon, everyone.
Good afternoon.
My name is Alicia Cleveland, and I'm a nanny in the Atlanta area. I'm a leader with the National Domestic Workers Alliance, chapter of Georgia. Thank you for having me today. I want to share with you all my experience, what my experience has been like for me and my family during this pandemic. Before the pandemic, I was nannying for 3 different families. Since April, I have not been able to work because my children have pre-existing conditions. I have 3 children, 5th grade, 9th grade, and 12th grade, who are all online learning right now. My experience during the pandemic has been extremely difficult, to say the least. Helping my children with online learning has presented a new set of challenges that my children and I had to navigate by ourselves. The technological learning curve for us was difficult, but having to buy 3 laptops out of pocket was more difficult. I'm feeling more and more burnt out as a mother that is constantly on call. This pandemic has been a struggle. I do not have the option to look for work because I need help look after my own children. This pandemic has working mothers do not have a choice. Either you go to work your else and leave your kids behind, or you don't work, help your kids to have no work and become financial. It should not be the only two choices at all. I'm deeply connected to the nanny network, and what I hear is pretty much the same thing. You need nannies so that they can go to work. Nannies now being expected to use their contract to assist online learning, but are not for the extra responsibility. It has created for nannies with parenting, but the wages have, so nannies are getting, which is below bare minimum because they're desperate for work. The only choices that we're given as domestic workers and as mothers, working mothers. As the original gig workers in this country, domestic workers deserve so much more, so much better than this. We need Congress to think about the millions of domestic workers across the country who have been forced into unfair and terrible situations. Those who can't find work, those who work in unsafe conditions, those who are paid starving wages, or those who can't get work because they have to take care of their own kids. Throughout this pandemic, domestic workers have been essential workers, but have also been treated as disposable. Please remember my story, because so many of my domestic worker sisters who are in the same situation as me. And please work hard to secure us some type of relief, because this pandemic has been excruciating and difficult because it feels like no one is looking out for us. Thank you for your time.
Mine in the Massachusetts 1st Congressional District. James.
Thank you, Chairman. My name is James Ryan. I have the honor of working as a history and social sciences teacher at the Honors Academy in Springfield, Massachusetts. On that note, Chairman Neal, I'd like to thank you for representing the 413, and congratulations on your re-election as chair. Now, while I also have the privilege of serving on the executive board of the Western Massachusetts Area Labor Federation, I'm here today as a teacher first, and I'll tell you, since the pandemic began, our schools have been facing tremendous challenges. Some of them new, and others that, quite honestly, have existed for years but have gone unaddressed. We've been seeing gross inequities in terms of access to reliable internet service. You know, the hotspots are a nice gesture, but let me tell you, as the school's tech coordinator, they do not work as well as they need to. Especially here in Springfield, where, to add insult to injury, we've been hearing that we're going to be having a cap on data usage for some ISPs. And that's only going to be hurting these households where parents work remotely and their children are going to school virtually. A lot of our schools have been in dire need of repairs and retrofitting and reconstruction for quite some time now. And the dilapidated state of their HVAC systems due to deferred maintenance have made them patently unsafe during this time. All the while, our districts have been facing substantial pressure, occasionally threats to our funding from, state actors who want us to return to in-person learning as soon as possible. And this is coming as our state has already seen hundreds upon hundreds of staff and students in non-remote districts contracting COVID-19, and then they end up going remote anyway. But beyond all this, just these technological and logistical issues, our biggest challenge comes from exactly who we are. Schools are more than just buildings where learning takes place. For many of our students, they're places of refuge. They're places where they know that they can have shelter, a few meals, the love and care and support of their friends, their classmates, the staff. All of these have been harder to get in a remote environment. It's not impossible. And I think that's more of a nod to the resilience of our schools, if anything, but it has been difficult. Because I think that you'll find that, most, if not all, teachers, we want to be back in the classroom. We miss our kids. We miss each other. We miss the school communities. We want to go back, but as we've been saying since the summer, not until it's safe. Not until it's safe for our staff, our students, our families, and we're just not there yet, and we need your help. That's why our unions have been so critical. Teachers have been fighting for the action needed to make these things happen since the moment we went remote in mid-March. Unions throughout the region have been advocating for the health and safety of our working families, and it's been a game changer. It's also hit home personally. My wife is a teacher as well, and interestingly enough, you all will know about this before many of our friends and family and colleagues, but she is pregnant. And with the known risk of complications, not only to her, but our child, the advocacy by our unions has been critical to her safety and that of our unborn child. So that's why I'm here before you today. We've been fighting to make things better, and we know that a lot of our local and state governing officials are doing the absolute best they can. But we also know that we can only do so much. Budget constraints are only making things worse, and that's why we're calling upon our federal leaders to pass this relief package and help get our communities back on the right track and make it out of this pandemic. Thank you.
Thank you, James. Let me now recognize Tishaya, who is from Pennsylvania, and she's going to speak next.
Hello. Good morning to the members of this committee. Thank you for allowing me to share my story today. My name is Tashia Fraser, and I'm a nursing home worker from Montgomery County, Pennsylvania. And I'm also a proud member of the SEIU Healthcare PA. I've been working in the healthcare field since 2003, and I chose this career out of a love for helping others during their most vulnerable times. This is a passion that I discovered during one of my most difficult times in my life. In 1999, my beautiful 5-month-old daughter, Nigeria, was hospitalized. Like any loving mother, I provided my daughter with extra care at the hospital. Soon, doctors and nurses encouraged me to go into nursing after seeing me with her. I never thought about pursuing a career in the medical field, but this experience has changed my mind. And when I wasn't attending to my baby, I was studying. Sadly, my baby passed away in 2003 before I took my Red Cross exam. Today, I honor my daughter's legacy by caring for seniors and people with disabilities. Providing care to our residents gives me the same feeling of love that I had caring for Nigeria. Tomorrow, December the 10th, is her birthday. Happy birthday, Nana. I can't think of a better way to commemorate and honor her life than advocating for those who need our help right now. According to the AARP, more than 91,000 residents and staff of nursing homes and other long-term care facilities have died from COVID-19. That's 40% of all coronavirus fatalities in the US. This alarming statistic is honestly just a snapshot of our reality. Wow. Some people look at the headlines on TV. CNAs on the front lines of this crisis are seeing patients and family members and coworkers. My facility closed its doors back in March And by the beginning of April, about 70 of our residents died from the coronavirus. It was devastating saying goodbye to our extended family who lived with us for decades. The saddest part has been knowing that their family members were not allowed to be with them in their last days. Today, our COVID survivors are passing away from other health complications, and we have also lost coworkers too. If losing residents wasn't hard enough, we're also understaffed. COVID-19 is really shining a light on the problems that started well before the pandemic. It has many nursing home workers questioning whether or not they should stay in this field. Our workforce, which is largely represented by Black and Brown women, have been vastly undervalued. We're often paid poverty wages and don't have enough paid sick leave or other benefits. How do we get people to stay in this field? If you're a healthcare worker, regardless of your job title, you should not have to struggle to get the help you need during COVID. We have to address the cracks in our long-term care system. Now more than ever, we need the members of Congress to pass legislation that, one, makes investments in our care infrastructure by valuing the essential long-term care workforce. We need increased Medicaid and Medicare funding to build a sustainable workforce and ensure nursing homes have the resources that they need. And we need to make sure that the nursing home industry is putting that money into workers in care and not in their pockets. We also need a $15 minimum wage, emergency sick days and leave, adequate PPE, hazard pay, and other protections for nursing homes and other essential workers. Please make a national effort to transform long-term care jobs into high-wage, family-sustaining union jobs. We need a seat at the table to have more transparency and accountability with our employers. When our employers say we're in this together, we can make sure that they mean it. Despite the challenges nursing home workers are facing around our country, I'm optimistic about our future. However, we need your help to build a path forward to a society that values our work and ensures that every person can age with dignity. Thank you.
Now let me call upon Kelly Newman from New Jersey. Kelly. You have to unmute, Kelly. There you go.
One moment.
Okay, so we'll come back to you, Kelly. And now we're going to call upon Ramon, who is from Florida. Ramon Williams, please.
Can you hear me?
I can hear you.
Okay. Well, thank you. Hi, my name's Ramon Williams, and I want to thank you all for giving me the opportunity to participate today in this roundtable. I'm currently a respiratory therapist at UF Health, Jacksonville. With respiratory distress common among seriously ill coronavirus patients, the respiratory therapists are at the top of the spear on the pandemic front line. I'm fortunate enough to have stayed COVID-free so far. In some ways, I feel the most important things that I want people to take away from my comments today is that I do not want you to experience what my coworkers and I have been going through since March. Nobody should have to go through this emotional pain, this overwhelming sense of loss, this unending stress. I want you to wear a mask and take things serious. The situation here in Jacksonville is so bad that we've converted multiple unit spaces to handle COVID patients. While this has helped increase capacity, it cannot stop the overwhelming number of cases. And with so many patients, healthcare workers are going to get infected too. In fact, outbreaks among the staff have at times forced us to shut down units, and in some instances, patients who did not have COVID have gotten it from the staff. We have been able to stand up and fight for ourselves through ASME union contract. We were able to get PPE to be made more available to all workers, not just those that work in COVID sections. And when staff are infected or exposed at work, we make sure the time spent in quarantine is not deducted from their personal leave time. To cope emotionally and physically, healthcare workers must draw on strength from our families. But our families add emotional stress because we are concerned about their health. I take care of both my elderly parents. We live in the same house. That means when I come home from work, I risk bringing home this disease to two high-risk people I love. I have committed myself to doing the best I can do from the moment I walk through the door to the moment when I leave. The most heartbreaking thing for me, and still gets to me, is we're doing it with no help from our elected officials, locally or nationally. People can go around treating COVID as if it's a joke, threatening the lives of others with no legal consequences. For instance, hospitals in Florida have opened back up to non-COVID patient visitation. There have been multiple occasions where visitors, knowing that they're COVID positive, have lied on their screenings to gain access. On their way out the door, they inform the staff that they have been exposed. Or what about the fact that people could lose their jobs for having COVID? Family Medical Leave Act protections only last for about 3 months. I've personally taken care of 3 patients that were hospitalized for longer than that with COVID. It's things like this which cause people to avoid getting tested and not to admit to having symptoms. And Congress itself has for too long blocked giving healthcare workers and any security by refusing to pass necessary support for states, cities, towns, and schools. This is about funding public hospitals like mine so frontline staff can keep fighting. You think it is bad now, imagine a world without respiratory therapists, nurses, EMTs, emergency technicians, and so many more. Think that's impossible? Well, it's 2020. How much of what has happened, which you have said was impossible at this point in 2019? Without Congress doing their job, this tough winter in America will be even worse. Thank you.
Go back and try Kelly Newman again. Kelly, do you want to try it again? I think we have a bad connection.
I believe, can you hear me now?
Yes.
Oh, okay, wonderful. Yes, just confirming I am being heard, correct?
Yes.
Okay. Good afternoon, everyone. I apologize so much for the technical difficulties. It's sort of illustrative of the things I'm going to say. Again, I'm telling you, my wife, Rachel, I live in New Jersey with 6 children under 10 years old.
Yeah, Kelly, we still have a bad connection. Yeah.
We were both professionals. Our children attended elementary school. Okay. Perhaps we can come back after a couple of years.
That's what we'll do. We'll come back to Kelly again. We've set aside time for you, so we'll see if we can work this through.
Thank you.
So now what we're going to do is we're going to hear
Thank you.
Rita.
So I apologize.
Rita? Rita? I can see you. I can't.
Hello? Can you hear me now?
Yes, we can. Yes.
Good afternoon. Thank you, Chairman Neal, and to all the members of the Ways and Means Committee for giving me the opportunity to share my experience working on the front lines during the COVID-19 pandemic. My name is Rita Noyes. I am a registered nurse. I am also a member and steward of the United Steelworkers. For the last 4 years, I have had the privilege to care for residents at a long-term facility in rural northern Minnesota. Pardon my nerves, for I feel the weight of all those working in long-term care during this pandemic. My hope is to relate to a small glimpse of this struggle every single day. As all common in long-term care, our facility has faced chronic issues with short staffing. The everyday tasks and responsibilities of our nurses include care for a wide variety of patients during a shift, including those with Alzheimer's, dementia, in hospice, palliative care, acute care for our short-term rehab patients, and increased complications of our patients with COVID. Burnout is a very real issue. Staffing is a revolving door. Despite facility attempts, we often can't even get new employees in the facility, and the struggle with retaining staff is an environment where all medical facilities are facing staff shortages. When the pandemic started this spring, it ripples of anxiety and concern through our already strained staff. Job duties increased, staff uniform requirements changed daily, and it felt as though we were waiting for a storm. Mask requirements went into effect, visiting restrictions tightened, and the impact on our residents was furnishing. As PPE shortages became a reality, our facility began rationing masks, and our staff were forced to wear a single surgical mask during their work week. This was the policy when our outbreak began. Despite multiple attempts to force management to create an action plan, floor staff concerns were ignored. Staff were encouraged to work despite symptoms with advice to wash your hands extra today. I was told by administration my concerns were not, that I would soon find out COVID isn't as big of a deal as it has made out to be. But as we pointed out, it was worse. It was an absolute nightmare. Residents and staff alike quickly began falling out. It's our facility came down the same way. Our already trained staff reached crisis levels. We begged for help. We begged for anything. We questioned whether we could even remain open. Our facility that typically distributes its long and short-term residents throughout 2 floors made the decision to pack all of our residents into a single floor, making it possible to widen the staff to resident ratios. During a shift, a single nurse could be expected to manage the care for over 35 residents. This involved medication administration, diabetic maintenance, home care, vitals, treatments, medication ordering, communication with primary care physicians, crisis management, the increase in complex needs of COVID positive patients, end of life management, and comfort care, communication with funeral homes, and providing a link between residents and their loved ones. All of this compounded by the reality that these are people we care deeply about. As the safety manager of our facilities stopped allowing visitors, this left direct care staff as the only support our residents have. Nurses are doing this, working back-to-back 16-hour shifts, often clocking 60+ hours per week. We are overwhelmed. We are exhausted. We have nothing left for our families. We have nothing left for ourselves. We have been left more vulnerable to infection, and a large part of our staff, including myself, tested positive for COVID-19. Some of us have been lucky. Some of us have been hospitalized, and some of us are still suffering long-term effects. We are hearing a massive load of grief from so many deaths so quickly that we haven't even had time to process. Emotion aside, the fact remains that this work is still occurring without N95 masks. Despite our facility having a large supply, we have yet to be tested for them. The uniform services were brought into the facility to assist, but by the time they arrived, it was too late. The inadequate staffing that has been repeatedly reported to the Department of Health remains because we have no federally or state-mandated staffing ratios to fall back on. We have filed a complaint about proper workplace protection and have yet to hear back from them. We need a better system in place to train and help maintain adequate staff. This is a system that was already struggling. The population we serve is not receiving adequate care, let alone the care they deserve. Again, thank you.
I'm going to suggest that all of our panelists would be invited to submit their testimony based on the delivery. We are experiencing a couple of difficulties with some of the audio, and I would suggest that if everyone could, who is not speaking, just to turn off their video until their turn. I think that would be helpful as well. So now let me call upon Anthony Murray from Indiana. Anthony.
Yes, thank you, Chairman Neal, members of the committee. So I appreciate the opportunity to speak with you today. I'm a firefighter and a paramedic in Hamilton County, Indiana, where I also serve as president of the International Association of Firefighters Local 4416. But since April, I've been working in a role that helps our crews with high acuity calls, COVID-related treat-at-home protocols, and education for our firefighters, EMTs, and paramedics. I'd like to use my time today to outline 3 unique areas of concern for the fire service that are made worse by the spread and response to COVID-19. But before I do that, I think it's important to know that as firefighters, EMTs, paramedics, we work in uncontrolled environments. Our workplaces are dictated by the unplanned emergencies that occur in places with unpredictable circumstances, such as inside a vehicle, a car accident, someone's kitchen, an extended care nursing facility. These work environments are in close proximity to patients that we can't be sure if they're affected or not. As healthcare providers, this leaves us open to a number of threats only made worse by this pandemic. So the first area I'd like to discuss is the personal protective equipment need. Firefighters, EMTs, and paramedics are the first access to the public health system, and we are by far the largest provider of 911 pre-hospital care in the country, and an ever-increasing number of EMS calls in my community are COVID-related. This guarantees that as community spread increases, my members will encounter the virus more regularly on a daily basis, which requires adequate and effective PPE to keep them safe. In addition to keeping responders safe, we have to keep our patients safe, and PPE helps us to do that. Without enough PPE, we risk sending our members into an environment where we cannot protect their health, which in turn only serves to weaken our ability to keep the community safe. For example, what we're seeing with PPE is that it's intended to be for single use, and we're using a lot of it. With high demand and production or procurement challenges, it leaves individual fire departments to the open markets. Our fire departments are not buying PPE by the pallet or semi-load, we're buying it by the case, which is a challenge when trying to make sure that we have enough PPE, because we end up competing with other healthcare workers that are also in need of this vital protection. The second area I'd like to speak about is regarding staffing and the shortages. When firefighters and EMTs aren't running calls and taking care of the sick and injured and responding to emergency, we're working in really small places, in our ambulances, inside the front compartments, and fire rigs, or whether back at quarters in the station, living together, having to divide up, space so we can space out to eat and have meals and rotate. In our case, there is no work from home option. Our work environment has become ripe for viral spread, and when one of our members becomes ill, the entire station may be forced to quarantine, creating debilitating staffing shortages. Staffing shortages doesn't just make it harder to respond to COVID-19 related calls, but all types of emergencies, such as structure fires, time-critical heart attacks, vehicle accidents, rescues, and other traumas. But when hospital resources are taxed, my workers are forced to find alternate transport locations for patients we are treating in the field, often resulting in longer distances to get a hospital that can accept that patient. And with this unforeseen necessity to adapt, leaves crews out in the field and out of service for other calls, to respond to other calls for a much longer period of time. And again, emergencies continue to occur despite the increase in call volume related to this virus, but we're still responding to the regular, if you will, emergencies, traumas, cardiac arrests, strokes, building fires, and any number of emergencies, in addition to calls for population needing care for seasonal flu right now as well. So reduced staff causes increased response time for us to be able to provide help. And last, I'd like to talk just a little bit about the paid sick leave. Once our members are forced to quarantine because of exposure, several examples exist where they aren't given proper sick leave like any other worker, or in other cases, application of this leave is inconsistent at best by their employer. There is a loophole that was created with Congress's fix in the first COVID bill that passed earlier this year, denying first responders guaranteed sick leave caused by COVID infection. In other words, it left the employer the opportunity to exempt those employers, those firefighters, paramedics, and EMTs from that coverage. This mistake has led to confusion within states and localities as employers apply inconsistent paid sick leave policies and deny workers' compensation coverage for COVID exposures contracted while on duty. But for the vast majority of firefighters, EMTs, and paramedics, the average schedule is 56 hours per week, in contrast to the 40-hour work week for most other workers. Some employers cover that employee that is off, one of our firefighters or paramedics, for COVID quarantine for only those 40 hours per week, leaving the employer or the employee to lose pay or to find some other way to make up that difference. So firefighters, EMTs, and paramedics are a critical component, not only in our public health care system, but for our defense against this virus. We need Congress to recognize this reality by passing legislation that provides more PPE, expands sick leave, and provides more funding for state and local governments. We see America at 2 a.m., and we know that America is hurting right now. Thank you, and all of you, for your time this afternoon.
Thank you. Let me now call upon Daniela Knight from Virginia. Daniela?
Can everyone hear me?
Yes.
Yes. Good afternoon, Chairman Neal and members of the subcommittee. Thank you so much for holding this listening session, and thank you to all the members that have shared their powerful stories today. Although our family has been fortunate to stay COVID-free so far, it has been a grueling 9 months for workers and families in general, and I am thankful to have the opportunity to share our family's experience because we need your support more than ever. My name is Daniela Knight, and I'm joining today from Alexandria, Virginia. I'm proud to be an active member of Moms Rising and a mother of 3 amazing kids, ages 3, 5, and 9. When each of our children were born, we struggled immensely without a reasonable amount of paid parental leave, having just 1 to 2 weeks to recover from childbirth and get our newborns off to a good start before feeling the enormous financial strain of having a child. If children are the future of this nation, we need to do so much more to make it possible for parents to provide quality care for them from the very start. We were already making many sacrifices, and my family struggled without paid leave and affordable childcare before the coronavirus pandemic. But we were managing to keep things barely afloat until our 5-year-old would start kindergarten and our 3-year-old would start half-day preschool in the fall. Since COVID-19, our lives have reached a level of challenge that we have not been able to withstand. Before the pandemic, I worked 2 part-time jobs. I managed a small property management company and worked as a realtor. My husband worked at a legal services firm. My husband and I were what I like to call tag team parents. We worked opposite shifts because full-time childcare for our kids was well beyond what we could afford. It would have cost more than my entire salary. If we had to pay for full-time childcare, we would not be able to afford our rent, utilities, etc. However, we earned too much to qualify for state help. Shortly before the pandemic, I took on a 3rd job as a pediatric sleep consultant, which meant that both my husband and I were working remotely after the kids went to sleep at night. It was exhausting, but we were starting to make progress saving up for a down payment on a house because we have outgrown the one that we have been renting. Then came COVID-19. Schools closed this spring, and now our home is our school, our preschool, and an office for both myself and my husband. Everything got so much harder. Suddenly, my husband and I were working from home while trying to homeschool our 3 young children. I didn't qualify for paid leave under the family's first coronavirus relief because my employer was too small. When I was unable to keep up with all of the demands, my employer granted me 2 weeks off in June, but it had to be unpaid. Just as I was returning to my job, my husband was laid off permanently. That was terrifying because we were already in a tight financial spot because of my unpaid leave. I frantically tried to take on extra work as a pediatric sleep consultant, and he tried to apply for unemployment, a complicated and confusing process. He was approved for unemployment assistance and should have received a weekly benefit that would have helped keep our family afloat. But to this day, more than 6 months later, we have never actually received a single dime. Despite repeated efforts, the Virginia Employment Commission is so unequipped to deal with the backlog that they are unable to tell us if and when we will ever see the benefits that we are owed. Thankfully, my husband started a new job as a government contractor in September, which was an enormous relief. However, before that, we were forced to use our savings to cover the most basic necessities, including paying $1,600 for 1 month of COBRA health coverage. When it was announced that our kids would be attending virtual school again in the fall, I made the tough decision to resign from my job managing the property management firm. It simply wasn't sustainable to work 3 jobs while trying to meet my kids' needs at the same time. I was not fulfilling my responsibilities well, and my health was significantly suffering. I applied for pandemic unemployment assistance and was approved, but my benefits are only $150 per week, which would barely cover our groceries for the family. Although I submitted additional documentation in September to receive more than the minimum weekly amount, I have thus far received no response on my request. I continue to work remotely as a pediatric sleep expert, but I face a delicate balance. I either ignore my children's needs during the day or put my 3-year-old in front of the TV to get some work done, or I stay up until 1 or 2 a.m. completing my work. Since I know how crucial this period is for their development, I am usually working well into the night. This is the only way we have found to barely keep up with our responsibilities. But we are under a huge financial strain. Property tax bills are due, and student loan payments will be due again in January. Putting a down payment on a home is no longer our goal. We will be lucky if we manage to stay above water and keep up with bills. We have felt firsthand what it is like to be a middle-income family in a childcare desert and the toll that it takes on families. We are urging policymakers, many of whom we know are also parents of young children, to respect mothers and families and realize how incredibly hard we already work for our families and our communities. And we need your support, especially now during the pandemic. Having no access to paid parental leave put us in a financial hole. Having no access to affordable childcare or being able to count on the unemployment we are owed made it impossible to dig out of it. At the same time, we are terrified about our children going back to school before it is safe. We are only as strong as our communities. Families and workers are the backbone of our communities, and we have been all but abandoned during this time. Like so many other families who are suffering while trying to weather this unprecedented storm, I'm counting on our elected leaders to stand up for workers and families by passing a comprehensive relief bill that includes expanded paid leave, emergency funding for schools and childcare, boosted unemployment and pandemic assistance, and more, that will continue for as long as it takes for us to recover from the pandemic and the economic devastation that it has brought. We desperately need lawmakers to step up for workers and families now. Collectively, we are too big to fail, and your actions now will reverberate for generations to come. Thank you.
So has Sherman Giles joined the call? Could you unmute?
Yes, I have joined, yes.
Okay, let me recognize you, Sherman.
Yes, my name is Sherman Giles, and I'm a grocery store worker, and I've worked with Kroger for about 37 years. Since the COVID started, it has been something that no one would ever think that they'd go through. The working atmosphere and just trying to stay health, social distancing. One thing I want to say about, just being I never worked so hard in our life, and we come out each and every day to our jobs as a regular day, not even thinking about a pandemic or a virus that's very deadly that you can catch, and we never think about that. But then in the beginning, was is to look at the situation. And we provide and make sure that things are in the meat case to where they as Kroger, we as Kroger, as essential workers, and I can just speak for all of them to, just we have dignity. And
Sure, we're having trouble with the connection. Yeah. Sherman, we're having trouble with the connection.
okay, how about, let's see. Okay, how about now?
That's fine. Go ahead. See if we can hear you better.
Okay, I'm sorry about that. You know, one thing that we would like from Kroger is to recognize us as the hardworking people that we are. And one other thing that we would like to say is that we would like to have our hazard pay back. You know, in the beginning, we were given hazard pay, and hazard pay goes a long way to, you know, $2 for a 40-hour person. That's $80. That's monies that we didn't have before. But now that since we are in this situation and that we have to show up for work every day and work hard and provide for this community, and we do this for Kroger and we do it for our families. You know, hazard pay isn't so much to ask for. The $2 that we received in the beginning, it lasted for probably about a month. And after that, Kroger shut it off, and now here we are, no hazard pay. And in each and every day, we just may see that our competition got a chance to keep their hazard pay permanently. We would like to have that hazard pay back. We work hard for it each and every day. You know, we're on the sales floor, and I asked, you know, some of my coworkers, you know, just how much of an impact did that do to you? How much of an impact did it have on you when you received it, and then you all of a sudden you don't receive it anymore? And their answers were just like I feel. They feel the way I feel, that, you know, our competition gets a chance to keep theirs, and we don't get a chance to keep ours. You know, we just want Kroger to hear us, and give us a contract that we can live with. We've been negotiating the contract for over 10 months now, and nothing. We can't seem to come to an agreement with a healthcare. What better now than healthcare to have good healthcare, actually, than during this pandemic. You never know when you got to take your family to the doctor. We come to work every day, and we have to go home every day, and we have family at home that, not knowing that you may be taking something back home with you. In the beginning, during this pandemic, you know, there were a lot of things put in place, like plexiglass. The plexiglass that Kroger has at the check stands and at the courtesy booth, they're not like some of the ones I've seen. You know, they don't actually kind of wrap around to where you can actually be shielded from whomever who walk up to the counter. And also, as counting the amount of people in the store, I haven't seen that yet. And that's one thing that we are really concerned about, is how many people come into the stores, uh, uh, how many come in, and how many goes out, and also having a person at the door cleaning the bass carts. You know, when you walk up to a store, see someone clean the bass carts for you. You might want to clean your own bass cart, but at the same time, you're showing the customer that you care about their well-being. You want to show them that you are trying to make it safe for them, you know, as they shop in your stores.
Thank you for your testimony, Sherman. And now we're going to move on to Selam Andarge.
Thank you, sir. Thanks for having me.
Thank you. Selam?
Chimney member of the community, thank you for listening me and sharing my story with you. And my name is Selam Andarge, and I work SeaTac Airport near Seattle. I do cabin clean my coworkers and I help keep airplanes safe. It is important work, especially during the pandemic. COVID is bad at work because there is no proper safety standard. We ride in van to each people, each plane with 7, 8 people. It's not possible to physical distance. Some people they wear mask and some people they don't wear mask. And I learned that one of the van driver got COVID and potentially exposed old people in the van, but the company didn't tell us since the pandemic started. I've been learned about 15 airport workers who have gotten COVID. We only find out about it from other coworkers. From most of this time, we had one break room where 20, 30 more than sometimes people would crowd together to eat lunch. Without union, we changed. With our union, we changed a lot of things, but we still need more safety rules. Without our union, HR doesn't listen to us. If we come to them with safety issues, they tell us to leave our badge and go home. They don't respect us. They don't see us like human. When someone got COVID, they hide. Like all the time they hide. We can't live or die. It's like it seems like they don't care. I don't feel safe, but I don't have a choice. We don't have a choice. We have to pay our bills. We have to live. We have to eat. We don't get unemployment unless we get laid off, and even some people they don't get it. I do everything to stay safe from COVID. I wear my mask, and when I got home, I change my clothes and leave my shoes outside. I disinfect myself. I don't see no one except my twin brother because we live together. I want to see my mom, my sister, and Christmas, but the job is not safe. It's not going to be just me and my brother. We need to be a respect when we are potentially exposed to COVID. They haven't to tell us the virus is killing people. We need to the companies, the airlines, and the government to respect us. And our company has given us just one mask this entire time. We need more PPE. We need central pay. And I have coworkers who got work and come home sick. I couldn't get sick and die today, and they just hire other person. What about us? And we need to be respect as a human being. And then like we need help. Mostly in Sitaki Airport, people getting affect a lot of employee. And thank you for hearing me, my story.
So we're going to give Kelly a chance again to see if our connection has gotten better. Kelly?
Thank you. Is our connection better?
Yes.
Okay, wonderful, wonderful. Thank you so much for having your patience with me and my technical difficulties beyond my control. Again, good afternoon, everyone. I'm Kelly Newman. My wife, Rachel, and I have 6 children under 10 years old. We live in New Jersey. Prior to the pandemic, we were 2 working professionals. We had in-home child care to assist us with getting our children to various schools and extracurricular events to help them with homework and get dinner started. We had a modest savings that we were able to add to each month that we plan to use to purchase our first home. Our kids were in a multitude of sports, recreation, extracurricular activities, Girl Scouts, Boy Scouts. We were able to worship in our faith community among our friends. We volunteered. We held gatherings, we donated to charities, we hosted a play group regularly for children on the autism spectrum. Unfortunately, as you're aware, none of this is possible now. We made the very, very difficult decision that I would leave work, even though as an attorney, I was the primary breadwinner, because my wife, as a public school teacher, she teaches high school in the school district of Philadelphia. Her union provides much greater job security and far superior health insurance benefits. And since our children have nowhere to be except home, one of us had to take that responsibility on and become the one who makes it all happen. And you're looking at her or hearing her, however we're accessing each other. The reality is that I'm an unemployed attorney collecting unemployment benefits, and we are financially eligible even for WIC. We receive food supplements also from the school. Our internet service is atrociously poor. We've upgraded as far as you can go, and yet you've seen here demonstrated what happens. Our bright, enthusiastic, overachieving kids are barely meeting the very minimum to pass even elementary school. Every single night I am called on, my wife is called on to comfort a river of tears. These kids miss their friends, they miss their family, their teachers, their outlets. They miss their coaches, they miss hugs. Oh, it breaks their hearts to not be able to hug neighbors. They miss parties and play groups. They miss normal. I miss work. I miss helping people beyond my immediate family. I miss being a vital member of my community. And more than just wishing that these things were different, we are struggling financially. We have no savings left. That whole nest egg is gone. We used it on the basics. We've made late payments on everything, on our cars, our utilities. Frankly, and quite embarrassingly, I'm here to tell you that we owe almost $2,500 to our electric company at this moment. We owe over $400 to the internet service provider. We are lucky in that we've maintained our health. We've been able to eat thanks to the subsidies we receive. We're not facing eviction. But we worry every single day about how absolutely unsustainable this precarious financial juggling is. We don't know what will happen in January. So many of the programs we benefit from are slated to end at the end of this month, and that cannot happen. We know that we will have no choice but to default on our student loans if that relief is restored or renewed thereafter. But I also want to say that we are all, each of us, struggling with our mental health. Again, not something that we usually freely talk about, but even accessing care is virtually impossible. No pun intended. We'll take virtual meetings. Closed facilities mean fewer options. Ending grant programs that have come to a close because funding was needed elsewhere has meant fewer options. Closed school means that my kids can't go to their guidance counselor. Unemployment, unfortunately not for us, but for so many others, means no health insurance to even access that care. Our kids need access. My wife and I need access. The isolation and the fear and the uncertainty is affecting all of us. It's affecting our health. Mental health is health. We need that area of our lives to be infused with greater options. The loss of beloved community members is devastating. The loss of access to our faith community. at a time that we need it most, has been really awful. On behalf of myself and all Americans, we're begging you to pass comprehensive relief. We urge you to err on the side of generosity when addressing the multi-layered issues. Comprehensive relief is critical. Paid family leave, unemployment expansion, cash infusions to families, money to allow schools to open again safely. These are critical. We cannot wait. We can't. We need you to work harder and longer days and not stop until relief is ensured. Again, we urge you to err on the side of generosity. This is not an issue we've worked so hard to create, and it's not the one we've promised our children. So please, with my thanks, with my sincere appreciation, please help us make it through this. Thank you again.
Thank you, Kelly. Now let me call upon the chairman of the subcommittee on worker and family support, Mr. Danny Davis. Danny?
Thank you very much, Mr. Chairman. Let me thank you for holding this event, which is very, very valuable and so important. I also commend the speakers who've shared their stories so that policymakers, so that we can better respond to workers' needs. As we turn to policies to help workers recover from the pandemic, it is critically important that we advance programs that assist workers with existing barriers to employment, such as the formerly incarcerated. I hear time and time again about the struggles of the formerly incarcerated Chicagoans, for whom trying to find employment now is even harder than it was before the pandemic. For example, LaTonya is a client of the Safer Foundation. LaTonya achieved a tremendous opportunity at the outset of this year. She's hired on a career track position as an insurance sales trainee for a large company. These opportunities aren't easy to come by, and especially when you have the stigma of a record in your background. However, when the pandemic hit in April, her program ended after only 3 months. She applied to several jobs over the interim, but jobs have been scarce throughout the pandemic and harder to obtain for people who have records. In August, she was fortunate to join Safer's Second Chance Hiring Program, which connected her to the J.P. Morgan Chase Economic Mobility Program. And after passing Chase's extensive vetting process, LaTonya began working on December 7th as a remittance processing specialist. Johns Hopkins University Medical Center and the Safer Foundation have premier programs to help the formerly incarcerated obtain training and jobs in health careers. Research in Illinois shows that employment programs for the formerly incarcerated yield $20 in benefits for every $1 invested. For our economy to recover, we must promote these programs that connect workers with substantial barriers to the workforce. So again, I thank you, Mr. Chairman, for holding this event. And I really thank all of the witnesses who have shared their stories with us. And I yield back.
Thanks, Chairman Davis. Let me now recognize John Larson. John, I think you have to unmute.
Hear me now?
Yes.
Well, thank you, Chairman Neal. And of course, I want to thank all of our guests. These are the kinds of things all members of Congress should be listening to. And in your eyes and in your words, we feel and hear the frustration of inaction. We assure you that we will continue to act under Chairman Neal's leadership to make sure that the benefits that you have so aptly outlined in your testimony are received. I don't know how members of Congress can go home and look in the mirror and say over this Christmas season that we've done our best when so many of our fellow Americans are hurting the way all of you are. Mr. Chairman, with your permission, I'd like to submit for the record letters from constituents of mine who, in response to wanting to listen and hear their stories, have submitted them, and I'd like to submit them to be part of the record. And with that, yield back my time and thank our guests for sharing their very poignant stories about their circumstances.
So ordered. Thank you, Mr. Larson. And now let me call upon Congresswoman Linda Sanchez. Linda? Linda? Okay, so what we're going to do is we'll come back to Linda in a moment. And why don't we recognize Congresswoman Gwen Moore? Gwen?
Thank you so much, Mr. Chairman. This has been very compelling testimony, and I guess what I wondered listening to everybody from Sherman Giles from Kroger, and Taisha Frazier from SEIU, certainly good spokespersons for people who are impacted by the pandemic and the conditions. I'm wondering, number one, one of the sticking points to our package, our COVID relief package, is to try to provide liability protection for corporations. And I just think that what we've heard today, Mr. Chairman, just from people who are so-called essential workers, who knew they were essential workers until this pandemic, that there's a real serious trust issue as to whether or not people will voluntarily do what they can to protect their employees. That's one of my takeaways from it. Whether it's James Ryan talking about the political pressure to open up schools without the proper construction of plastic or whatever. Alicia Cleveland talked about starving wages. I will attribute that to her the first time I repeat it, but then after that, I'm going to steal that because it's such an oxymoron to be working and starving at the same time. I guess my overwhelming concern, the thing that I think that has brought a lot of clarity to me, is the importance of expanding the earned income tax credit and recognizes some of these workers like Taisha. She said she went into nursing because she recognized that she had a palliative spirit and wanted to help people. How will we recruit people and retain them? She asked the question. If we don't give them family leave, we don't give them health care, we don't recognize them as essential workers. And as she mentioned, the problem existed before the pandemic. So, as a person who is over 65 and realizes that people in my cohort are turning 65, 10,000 of them every single day, she's absolutely right. I have provisions in the earned income tax credit would really recognize caretakers to a much greater extent, not only those who work in institutions, but at home, to be able to avail themselves of some benefits. So I just appreciate all of you for coming. And again, I just want to thank the chairman and the staff for finding real live people, because we hear a great deal from experts on this committee, so-called experts, but these people are truly experts today. And I yield back.
Gwen, let me now recognize Mr. Kildee, Dan Kildee.
Thank you, Mr. Chairman. First of all, I really appreciate
you holding this session. I think so much of what we discuss here in Washington sometimes sort of defaults to what sounds just like a policy debate or policy differences. And the truth of the matter is, what these witnesses have been able to do for us, I think it's really important, is to put a human face on this pandemic and to show that there are real life implications for the unwillingness of some in this town to act. And, you know, we've done that. You know, 6 months ago, we passed what we think should be the next piece of legislation, the HEROES Act. In a gesture of cooperation, we came back a couple of months later and passed the smaller version to try to show that, look, we're willing to find middle ground. And we're still trying to get there, but it does seem as though some people here in Washington haven't taken the time to hear the compelling stories that these witnesses are telling us. If they did, some of these differences just melt away. We've got to get to yes. We've got to find a way to provide direct help to these folks who are just representative of millions and millions of Americans that work hard, try to do the right thing, and through no fault of their own, have found themselves in these circumstances because of this pandemic. The health and economic impact of this pandemic is as we see here. You know, I've received, as others have, literally thousands of calls and letters and emails from constituents saying, get this done. Just please get this done. I heard, for example, and I'll submit this, Mr. Chairman, if you don't mind for the record, I heard from our one of our library directors, for example, you know, one of those essential public services where they now, because of the pressure they're under and the additional costs they have, are having to cut services at a time when access, and this is just an example, but access to library services really is, in some cases, a lifeline. It's the internet access that some people have to have in order to stay engaged in the economy. It's that kind of impact that, while some of our colleagues here in Washington seem to think that we should be dismissive of the public sector implications of all of this, it has an effect on the lives of people who are trying to stay connected to the economy in any way that they possibly can. So it's important that we hear these real life stories. And I want to just say to the witnesses before I yield back, Mr. Chairman, thank you for, number one, having the courage to come on this discussion and tell your stories. It's not easy. I know it's not easy because nobody likes to share with the rest of the world their troubles. These are troubles that people are facing because this government, this federal government, has not been able to act. And it's because we have partners here who just don't really believe that we ought to get something done. They kind of feel like people should be on their own. They ought to be able to fend for themselves. Our chairman doesn't believe that. We don't believe that. That's why we're continuing to push to get something. And the most important way we can do that is what we're doing now. Show that these are real life stories. This is not an abstract debate over theory of policy. This is about getting help to people right away. We have to act now. So thank you, Mr. Chairman.
Thank you, Dan, very much. And let me come back to Linda Sanchez. Congresswoman Sanchez.
Yes, thank you, Mr. Chairman. I'm sorry I was having technical difficulties earlier, but thank you for this opportunity to hear directly from those who are hurting most from the pandemic. I want to start by thanking each of our guests for their bravery in sharing their stories with us. This pandemic and the economic crisis it has caused has pushed working families past their limits. And it's demonstrated how many of our neighbors and family live just one paycheck away from experiencing homelessness and hunger. There's no shame in admitting that this year was the straw that breaks a camel's back. But there is shame in doing nothing about it. That's why 7 months ago, the House passed the HEROES Act to extend unemployment benefits and get financial assistance directly to working families. While we've been waiting at the negotiating table, we've also continued to act in the House. We passed the Child Care for Economic Recovery Act to ensure working families have access to quality, affordable childcare during and after the pandemic. We even passed an updated HEROES Act to jumpstart negotiations and to try to meet the Senate halfway. But shamefully, the Senate has done absolutely nothing. Meanwhile, my constituents and millions of Americans face a painful reality, including those frontline workers who put themselves at risk every day to keep our society and our communities running. They clean COVID-19 patient rooms like Miguel in Cerritos. He wrote to me saying that he is terrified every time he steps into a room. If we had signed the HEROES Act into law, Miguel would be properly compensated for his work on the front lines. Instead, he's forced to live in fear while making minimum wage every single day. Lee from Lakewood also faces a familiar challenge for working mothers. Her child's preschool shut down early in the pandemic, so she's forced to stay at home to care for her preschooler. And she's been looking for work, but she can't find work that will allow her to work from home. If we had signed the HEROES Act and the Child Care for Economic Recovery Act into law, Lee would have some peace of mind. Instead, with all of her unemployment benefits about to disappear, she's out of options. Isabel from the city of Whittier is living a nightmare along with millions of her fellow restaurant workers. With enhanced unemployment benefits gone, she was forced to return to work earning a fraction of what she formerly made just to keep her head above water. Now, with all of her unemployment benefits about to run out and new stay-at-home orders in Los Angeles County, she has nowhere else to turn. For every one of these stories, there are millions more that we will never hear about. But one thing is clear, it shouldn't be this way. We can do so much better, and we owe it to all of our constituents not to stop fighting until we've rebuilt a society where this doesn't happen again. Mr. Chairman, I want to thank you for calling this roundtable, for allowing us to hear these firsthand accounts of how people are struggling, and to hopefully light a fire under the Senate to get their work done on behalf of the American public. And I thank you and yield back.
Thank the gentle lady. Let me call upon Congressman Don Beyer now, who's also the chair of the Joint Economic Committee. Congressman Beyer.
Mr. Chairman, thank you very much. I really have enjoyed, if that's the right word, this listening session. And thank you for allowing my constituent, Daniela, to be here and share her story today. Mr. Neal, Chairman Neal, there's little that I can add. We have an email box full of these sad stories, but just listening today, it reminds me that if we go back to January or February, when the stock market was at 29,000 and unemployment was at 3.5%, there were too many folks strutting around saying the best economy in American history, when we knew that more than half of the American people were struggling just to get by. And then when Corona virus hits, one blip, major blip, and all of a sudden we see this enormous human pain. You know, I thank you so much, Richie, for your leadership to try to get these unemployment benefits to people. They ran out on July 31st. To get that first $1,200 check, which helps so many people, which has been nothing for the last many, many months. I get so frustrated when I hear people say Congress isn't acting. Under your leadership and the leadership of Speaker Pelosi, we have done it again and again and again. And I look across the aisle, specifically at the Senate Majority Leader from Kentucky, and say, where, my God, is your empathy? Where do you care for these millions of Americans who are in desperate, dire need, people that we heard from today? So thank you for working so hard to try to get a package through that the Senate will pass, that the president will sign, that delivers this help to our citizens who badly need it. This is very real. It is our responsibility as moral leaders to do this. And I'm grateful that you brought these stories up today. And I yield back.
Thank you, Congressman Beyer. Let me now call upon Congressman Jim Panetta from California. Jim?
Thank you, Mr. Chairman. I appreciate this opportunity to hear, to listen to, and to feel these emotional stories that we've had over this past hour or so. I want to echo, obviously, the comments of all of my colleagues who have just spoke. and say thank you to all of the witnesses who I would say testify. And I say that because as a former prosecutor, you hear a lot of testimony that can be very emotional. And the stories that we heard today were very emotional. But let me tell you what I look at it as, not just emotional stories, but I plan on using this as evidence, because we're going to use this evidence to make our case, to push our colleagues to make sure that they hear your stories as well. My good friend Dan Kildee from Michigan talked about how there are some members who just don't listen to these stories. Well, it's our job to make them listen. And you provided us with that evidence to make our case so that they do listen to us, so that they do act. Now, I think just like my colleagues, I too have received many of these types of stories in my offices on the Central Coast of California, including Jeff, a veteran who lost out on a work opportunity, and Eleanor, a librarian who got laid off and has a second grader at school, in school, who's now at home trying to learn full time. And so there are a number of constituents in my district that are struggling and that have reached out to us to tell us their emotional stories. And I have and will continue, combined with your stories, to use that as evidence so that we can continue to pass another package that will be so beneficial to all of us, not just you, not just people in my constituents, but to the people across this country. So once again, thank you for providing us with the evidence upon which we can make our case for you. Thank you, Mr. Chairman. I yield back.
Thanks very much, Jim. Now let me call upon the gentleman from Las Vegas, Nevada, Congressman Steve Horsford. Steve?
Thank you very much, Mr. Chairman, Chairman Neal, for hosting this virtual roundtable, to the subcommittee chairman, Mr. Davis, and for the opportunity to give a voice to so many Americans across this country who are calling on us as representatives of their government to step in and do our jobs to provide additional COVID relief that is long overdue. I want to thank the courageous individuals who shared their stories today. Like my colleagues have said, it's gut-wrenching what each of you are going through, and each of us have constituents in our own districts. And I want you to know that we hear you, we see you, and we will fight to make sure that we deliver the support that you and your families desperately need. I also want to join in with my other colleagues because I have a district that has been among the hardest hit in the country. There are parts of my congressional district that have the highest rates of COVID infection and deaths, the highest rates of unemployment and people who are struggling, the highest rates of small businesses that are unfortunately closing shop because of the effects of this pandemic and its impact on our economy. And so I am working hard every single day along with my staff to make sure that we are delivering, but I also want to raise up the voices of Rayla Allen, who's an emergency department registered nurse. She works as an emergency department registered nurse at a hospital in Southern Nevada. And she is one of the many people working with COVID-19 patients on a daily basis. Relaya is currently on her 8th day of a 14 straight day work schedule. Every day she works 12 to 13-hour shifts. Sadly, she and some of her colleagues do not receive N95 mask, hazard pay, nor do they receive adequate testing. Every day after she returns home from work, her routine is to decontaminate herself in her garage for 30 to 45 minutes before entering her home, where she lives with her 2 young daughters and her husband. This is happening in our communities. It's unacceptable, and it's not how we should treat our first responders and our heroes. I also want to lift up the story of Richard Bainan, a respiratory therapist, another constituent who's working with COVID patients on a daily basis. But Richard also has an underlying health condition for which he receives treatment every week. Richard works with limited staff in his department, and he worries that his job may eventually be subcontracted out, at which point he would lose his union protections and his health care, which he needs for his treatments. Richard is also working extra shifts with no extra pay due to an uptick in COVID patients. So I'm here today to say to hospital workers, you deserve the dignity and the respect that frontline heroes also deserve. We must improve working conditions for our frontline healthcare workers and pay them for risking their lives to save the lives of others during this global public health pandemic. We all know that more healthcare workers are needed to help mitigate the long work days and hours many healthcare workers are forced to deal with at this moment. And that's why the Ways and Means Committee Democrats fought for an expansion of the Health Professions Opportunity Grant so that we could increase the healthcare workforce. But at this moment, we need to deliver COVID relief for all of you. I stand with all of you, and I'll continue fighting to deliver the assistance that you are asking us to provide through your government as taxpayers. Thank you, Mr. Chairman, and I yield back.
I want to thank Congressman Horsford. Let me, as we conclude, thank our panelists. Your testimony was vibrant. It also, I think, gave us a very good indication of the need that still exists. The CARES Act, as we originally constructed it, saved the American economy, and we need to do this again. And guess what? We're likely to have to do it again after Joe Biden takes the oath of office as well, when we have a chance to make a better assessment once again. So you took time out of your lives to acquaint us with the testimony. It was very important. I want to reassure you that the Democrats are going to continue to fight for you here in Congress on these measures and others as well. And we understand the challenges that you have, and we're committed to getting you some of the relief that you all need. Thank you all very much.